Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the disorders of bones and joints in children. The disorders may be genetic or otherwise. They may be of many types. Congenital malformations like Talipes equinovarus or clubfoot. This is the commonest of the live births. Half of the cases are unilateral. It usually occurs along with meningocele. Arthrogryposis, myeloidostrophy types: mild, flexible and easily corrected; severe, rigid and resistant for correction. Etiology: not certain, but half of the cases show hereditary tendency with a defective gene theory. Other suggestions is due to diminution of the amniotic fluid. The limbs are pressed with the uterine wall and attain the malformation. The deformity consists of an inversion of forefoot and its downward displacement at the ankle. The ligaments at the medial side are contracted, underdeveloped and short. Those on the lateral side are stretched and relaxed. Bone defect and contraction of tendo-Achilles occurs in case of neglected cases. Treatment: it is important to begin the treatment in the first week of the life and completed by 4th month. Mild cases are treated by manipulation of the foot in corrected position rigorously twice a day. Achilles tendon needs stretching to prevent recurrence. Severe cases: Dennis Brownie's splint along with the adhesive plaster is used, the bar being bent with each application until full correction. If by the end of 4th month the deformity persists, tenotomy and plaster cast are indicated. Dysplasia of hip joint, congenital dislocation of the hip joint. This is relatively rare and mild cases, usually corrected by holding of the child to the side of the mother. Wide abduction corrects the deformity. Clinical signs depends upon seen before the dislocation or after. Before dislocation: extra fold of fat on the thigh and genital region on the side of the dislocation. Difference in the length of the limbs, limitation of abduction and spontaneous movement. The radiographs show hypoplasia of the femoral epiphysis, increased angulation of the acetabular roof and the deformed Shenton's line. After dislocation, the skin folds in the gluteal, inguinal and the knee regions are marked. Limb external rotation and shortening of leg observed in children started walking. A click may be heard by forced abduction. Bilateral cases exhibit a wider intercrural space and a waddling gait. Telescopic may be observed a radiograph upward and outward displacement of the underdeveloped femoral head and poorly developed acetabular roof with contrast medium like arteriodome injected into the joint. The limbs, which is unossified superior rim of the acetabulum, is seen between the head and the main cavity. Treatment. Traction in abduction, which is best achieved by gallows splint with the buttock raised, position maintained by pillows or diapers. In late childhood, reconstructive surgery may be necessary. Coxa vera. The neck of the femur is less than the normal. There are a variety of deformities. The angle of neck is less than 90 degrees. The commonest cause is rickets. When diagnosed early, treated by keeping the child off its feet during acute stage. In leg calviparous disease, the coxa vera is due to osteochondritis dissecans, articular necrosis of ossification centers. Treatment. Protection against weight bearing and then orthoplastic procedures are done. Infections. Osteomyelitis caused by Staphylococcus, Streptococcus, Brucella or Salmonella. The abrasion or an infection in the mouth or the throat can cause the infection. Usual site is the long bones of the lower extremity. The infection is ushered by high temperature, chills, malaise, severe pain and local tenderness. Differential diagnosis: rheumatic or pyogenic arthritis of neighboring joints, scurvy or yaws. Treatment: local splintage and massive antibiotic therapy. Later, when pus is formed, drainage is to be done, otherwise necrosis of bone may be resulted. Chronic osteomyelitis: it is usually a result of untreated acute condition. The intramedullary collection of pus escapes subperiosteally, where its pressure on the vessel leads to the death of the bone, which sequestrates slowly. Pyogenic arthritis occurs in undernourished children and in tropics. It may occur by hematogenous spread or by extension from the adjacent soft tissue. Mostly hip and knee joints are affected. Common organisms causing the infection are Staphylococcus aureus, influenza, pneumococcus, Brucella, tubercle bacilli. Symptoms: severe pain, joint rigidity, child is gravely ill, fever, malaise and vomiting. Effusion, which rapidly becomes purulent, causing swelling, tenderness and warmth. Destruction of cartilage and necrosis of heads of long bones and pathological dislocation may occur. Differential diagnosis: rheumatic arthritis, tuberculous arthritis and acute traumatic arthritis. Treatment: immobilization of the affected joint, repeated aspiration of the joint, antibiotic therapy after culture and sensitivity of the aspartate for 2 to 4 weeks. If neglected, certain amount of destruction is inevitable. Pathological dislocation. Non-rheumatic arthritis. Arthritis in blood disease, hemorrhage into joints, hemoarthrosis, common features of hemophilia. Treatment: bed rest, blood transfusion and administration of AHG. Arthritis in scurvy occurs as a result of subperiosteal hemorrhage. It can be confirmed by sciogram. Treatment: large doses of oral vitamin C. Transient synovitis of hip. It is a self-limiting disease seen between 2 and 10 years of age, more in boys. Symptoms: pain, limb following a local injury or a respiratory infection. It may be lost for several days to several weeks. Treatment: symptomatic treatment is indicated. Weight bearing is prohibited. Complications: Parthes disease, generalized infections of the skeleton and mesodermal tissues, mucopolysaccharidosis, Morphan syndrome, gracilis habitus with long extremities, spider finger and toes. Arachnodactyly occurs anomalies, arched palate, spine and chest deformity. Cardiac disease treatment: supportive measures and correction of the defects. Osteogenesis imperfecta, brittle bones, blue sclera, hereditary tendency for deafness and flaccid ligaments. It is an autosomal dominant fatal type. Osteogenesis imperfecta congenita, born with the deformities, second group. Osteopathirosis or osteogenesis imperfecta tarda. Third group, only slight fragility, dentogenesis imperfecta, only seen in some cases. Healing of fracture is rapid and satisfactory. Treatment: no specific treatment. Adequate vitamins: vitamin D, magnesium oxide and 15 milligrams orally per kg per day. Achondroplasia, osteoporosis, Albus Schwarber's disease, infantile cortical hyperosteosis, Caffey's Smith-Roth syndrome, Pycnodysostosис. Connective tissue diseases: juvenile rheumatoid arthritis. This is a common disorder in children after infancy, more in girls. Clinical features: joint inflammation is symmetrical, small and affected. Chorditis, hepatitis and ocular changes are seen. Types: Still disease, Peltis syndrome, Sjogren's syndrome. That's all about the diseases in the children, disease of bones in the children. And in the next video, I will discuss about some other disease. Thank you.